So recently, my colleagues and I looked at Medicare beneficiaries under the age of 65. So these are basically disabled workers who qualify for Medicare benefits. And we looked at use of opioid painkillers in this population. I think many people know that there's an opioid epidemic in this country. We're losing about 16,000 lives a year to overdose due to prescription painkillers. And the use of these painkillers is quite prominent in this disabled population. About half of them will fill a prescription for an opioid painkiller in a year, and about 1 in 5 will fill a prescription for these painkillers, chronically. So in basically every quarter of the year. And it turns out that states have been very active in legislating approaches to curb prescription opioid use. And they have a number of different approaches, everything from limiting the quantity of pills that providers can prescribe to requiring providers to register for a prescription drug monitoring program. And these efforts, some of them are easy to implement, some of them are not. Some of them are quite costly, and we don't have a lot of evidence about what works. So we've studied these patterns over a 7-year period to try to understand what works, and what we're finding is that any impact at all is quite modest. So, which kind of leads one to say we need to rethink our approach to this. The answer to this may not lie in legislative solutions to this problem, at least in this vulnerable disabled population.